My name is Martin Peters and I'm the Director of Residential Services here at Samarpan. I've had a long career in mental health and addiction field, starting in 1991, and have worked throughout services within the UK, which have been places such as the National Health Service, HM Prison Service, and some private provision providers for addiction services. I've spent the last 17 years working in Southeast Asia and as one of the pioneers of the international rehab facilities within Thailand, and was responsible for running a group of rehabs with a maximum of 75 beds up until last year. So my role here at Samarpan is very similar in that I've been involved in the setting up of the rehab, designing the program alongside my colleague, the Deputy Director, and also my colleagues in Mumbai. As much as I work with clients, I'm also responsible for ensuring that the centre runs smoothly within the operational side, and I spend time both with clients and staff. A lot of the work also that I do is with clients, so I do hold a caseload. I do run groups within the programme, and often I will be the first person that people speak to if they contact the centre for an inquiry. The first step's always the most difficult for people when they're deciding whether to come for rehab. So the first thing I would say to someone is, if you have a concern, then maybe just pick up the phone and have an initial chat with someone. There's nothing to lose from having a chat with a therapist, and you can speak with either myself or Obi, or if you're a Hindi speaker, then we have one of our Hindi speaking therapists that we're more than happy to speak to you about, what rehab is about, what are the benefits about rehab, and if it's actually suitable for you. Not everyone needs to come to rehab. Some people will require a different level of support. In terms of Samarpan, what's different? I feel that with us, the way that we developed our program and deliver treatment is very inclusive for the client. So they're involved throughout the whole process of their treatment with their therapist. They're treated as a person, not as a patient. We involve the family, and we work as a team here. We cover a whole range of different interventions whilst people are in treatment. It's not just about doing 12-step work, it's about doing cognitive behaviour therapy and relapse prevention. So it's a very, very eclectic and integrated approach to treatment. So working in India is an interesting place. I think having worked over a number of years in different countries, both in Asia, Europe and North America, and been exposed to working with clients really from across the globe, it's really important that we always understand the cultural diversity of our clients. From my experience, I've worked with a considerable amount of clients from India that would fly out of India for treatment services. And what I've found is that one of the very, very important parts for Indian clients is the inclusion of family. Family is a huge part of someone's treatment. So we really ensure that clients here are exposed and also given the opportunity to work with their family. It obviously presents challenges. It can be supportive, but it can also be challenging for some of our clients. So we work with the family to educate them about what they need, and obviously we also offer family sessions both here and within our Mumbai office. So it's a very, very cohesive approach to address some of the issues that really are prominent with our clients here from India. This is one of the most difficult questions. It's often the case that I receive many calls from family members that are concerned about a loved one. And not all loved ones are necessarily ready to come for treatment, or they might be in complete denial about the issues or what is actually happening. Some are not well enough to make a decision to come to treatment. The real first step for any family member really is actually accessing a service, and I really would encourage any family member to reach out, give us a call, have an initial chat with either myself or one of my colleagues. If they feel that they need some additional support, we have a great outpatient service initially for family that can also provide them with some support, and also, to facilitate helping someone get into treatment. One of the really important parts here about what we're a little bit different is that all of our clients that come here must be voluntary. So none of the clients that come into Samarpan will be an involuntary admission. So that's the really important part. We'll work with the family. Hopefully the client is going to be willing to come to treatment, but the first step really is about asking for help, which is a really important step. So Samarpan is an international rehab because we have a team that is Indian, as well as we have some Western staff like myself and my deputy director. We certainly cater for clients from around the globe. We've had several clients already into treatment here that have come from overseas, and we expect more to come here. But ultimately, we are effectively an international rehab in India. Probably a little bit different than what's been in the past. A lot of Indians have travelled overseas for treatment, and really what we're doing here now is actually delivering treatment in India that they would normally have gone overseas for. I think the big difference here in terms of how we deliver treatment is that firstly, we're voluntary. We don't take any clients that are involuntary. The second part is that our vertical for treatment is very clear. We're not going to be taking people that are presenting as acutely unwell, and when I mean that, I mean people that may be going through a psychotic episode, or may be having a depressive episode, or have dementia. We do not cross-pollinate our clientele group with people that are not suitable for what we really call is a primary addictions treatment program. So people that come here are here to work based on their addiction, not any of the other stuff that often other rehabs may take. So whilst we understand that many of our clients that come in will have these as co-occurring disorders, we are not going to take someone with just a primary diagnosis of depression or schizophrenia. The other part, I think also, which is really important, is that we've used a slightly different model than a lot of the programs here in India. Our treatment's much more integrated in terms of how we deliver it. We're also very sort of what I would call experiential in the way that our groups are run, that we involve clients in their treatment process. We use research-based approaches to treatment, and the way that we design treatment and formulate treatment for each individual client is different, and it follows a tried and trusted method. We're not just about doing 12-step work. We do 12-step work here for clients, and we actively encourage clients to engage in the 12-step fellowship, but that's not the only thing that we do. We do psychotherapy, we do relapse prevention, we do personal training, Reiki, massage, all sorts of other different types of interventions. And also, the important part here is that we challenge our clients in all aspects of their stay. It's not just about what they're doing in terms of their drinking or their drug using, it's also around about the behaviours that are associated with that.